Bismillahirrahmanirrahim. In this video, we are discussing certain important causes of polyhydramnios, as I have written already. Okay, basically, we divide the causes of polyhydramnios into five main groups. Now, first of all, maternal causes. Okay, any maternal cause, uh, especially diabetes, that can cause the polyhydramnios. Secondly, we have certain fetal causes, which we will discuss later. Okay, number third is that of placental causes. Okay, we have certain placental conditions which can result in polyhydramnios. Fourth is that of the effect of certain drugs. Okay, and number fifth is idiopathic. So basically we have five main causes. We have to keep in our mind these five main categories in order to know about the causes of polyhydramnios. So now I'm making some important drawing in order to make you understand the causes of polyhydramnios. Okay, this is maternal abdomen, and that is the spine. The vertebral column on the back, which I'm drawing now. Okay. I'm drawing the placenta. That is basically the placenta from which the umbilical cord arises and is supplied to the baby. And we have a lot of water inside the womb, and that indicates the polyhydramnios. Okay, the baby is inside the womb, and we have a lot of waters in around the baby, means polyhydramnios. And also we have one another fetus, means it is the twin pregnancy. The one which is on the front looks a bit larger than the one which is on the back, so means there is some sort of discrepancy in that. Okay, so coming to the causes, as I have told you, the first cause is that of the maternal, and the most important among all the maternal causes is that of diabetes mellitus. Okay, so when a mother comes with a history of enlarged abdomen, we have to check the maternal BSR level as well, and do proper screening depending upon the risk factors as mentioned in the NICE guideline of the diabetes mellitus. So diabetes mellitus needs to be ruled out whenever we find polyhydramnios on ultrasound scan. Okay, polyhydramnios is there on ultrasound scan, diabetes mellitus needs to be ruled out. Now come to the fetal causes. Okay, as we have mentioned that fetal causes are very important. Fetal causes of polyhydramnios include, first of all, the multiple pregnancy. You can see that there is multiple pregnancy. Two kids are there, two babies are there, sorry. Multiple pregnancy. The first fetal cause is that the multiple pregnancy. We need to rule out that. And among the multiple pregnancy, it's very important to know about whether there is twin to twin transfusion syndrome or not. Okay, which is common in case of the monochorionic pregnancy. Okay, multiple pregnancy, especially the in case of the twin to twin transfusion syndrome, that is a very important cause of polyhydramnios. Now, another important cause among the fetal abnormalities is that of certain urinary tract abnormalities. The condition which is called the Barter Syndrome. Like this, I have drawn the kidney of the baby, and there are certain problems in it. So that is one of the causes. Okay, Barter Syndrome. That is another important cause of the polyhydramnios. If the baby of the fetus has got Barter syndrome, which usually manifests later, then that is a very important cause of polyhydramnios. So twin to twin transfusion syndrome, secondly Barter syndrome. And it would be better if I include this Barter syndrome among the structural abnormalities, so as to make the things clear. Structural abnormalities. Okay, Among the structural abnormality, first of all, we need to remember the Barter syndrome. Okay, the causes, I would like to repeat, first of all, multiple pregnancy. Secondly, the structural abnormalities in the fetus like Barter syndrome. Now there is another condition in which there is failure of fetal swallowing, and that is called the tracheal atresia. Okay, tracheal atresia is a very important abnormality. Okay, this is the trachea. Okay, and this trachea is blind. Okay, so that is the condition which is called the tracheal atresia. Okay, and that is esophagus, that is stomach. Okay, so that tracheal atresia can result in failure of the swallowing. Another condition is that the duodenal atresia. This is the duodenum, and this duodenum has got atresia. So another important cause is duodenal atresia. There is failure of swallowing of liquor, and that results in increased liquor volume. Moreover, there can be a mass in the thorax or in the mediastinal region. Okay, so that mediastinal mass is another structural abnormality. First, multiple pregnancy. Secondly, structural abnormality like mediastinal mass. Mediastinal mass. Okay. Now there is a condition. Okay, this is the chest portion. Okay, of the baby. Okay, this is the diaphragm basically. Okay, so there is a condition. Okay, that is basically the diaphragm. There is a condition in which the intestinal or abdominal contents go through the diaphragm into the chest area. This is called hernia. Okay, diaphragmatic hernia. So that diaphragmatic hernia is another important cause of polyhydramnia. If the baby has got diaphragmatic hernia, that is included among the causes of polyhydramnios. It's because in case of diaphragmatic hernia, we have extrinsic intestinal compression, which prevents the reabsorption of the liquor, resulting in the increased liquor volume or the polyhydramnios. Now coming to the third fetal cause, we have certain neuromuscular problems in the fetus as well. Neuromuscular causes. Okay, the neuromuscular causes include anencephaly, muscular dystrophy, and fetal akinesia. There are certain babies in whom the major portion of the brain is missing. That condition is called anencephaly. And in that case, we have polyhydramnios. Some babies are having muscular dystrophy, and there's another group of babies having fetal akinesia. Okay, so these are basically the neuromuscular causes. Okay, anencephaly, muscular dystrophy, and fetal akinesia. These are basically the neuromuscular causes of the polyhydramnia. Another thing which we need to remember in this fetus are those of genetic causes. Okay, certain genetic causes can result in polyhydramnios, and those genetic causes include the chromosomal abnormalities like trisomy 21, 18, and 13, and we have certain non-immune head drops. Okay, non-immune head drops. Now the fifth important cause in the fetus is that of heart failure. Heart failure or cardiac failure in the fetus can result in polyhydramnios. Okay, this fetus is having heart definitely, and that heart, due to certain condition, has failed now. Now, what are the conditions which can cause the cardiac failure? There are multiple conditions. It's very difficult to write each and everything here, but I would like to tell you that anemia due to any reason in the fetus can result in cardiac failure, as all of you know. Sacrococcygeal teratoma can cause. Then there are vein of Galen aneurysm in the fetal heart that can cause the cardiac failure. Okay. Fetal anemia, as I have told you, maternal immunization can cause the cardiac failure. G6PD deficiency in the fetus can cause the cardiac failure. Alpha thalassemia and fetal-maternal hemorrhage due to RH incompatibility and many other causes. These can cause the cardiac failure, and that in turn can lead to polyhydramnia. So whenever there is polyhydramnia, we have to keep all these things in mind, that there can be any cause like that. Now coming to the last fetal cause of polyhydramnia, the sixth one, that is infectious cause. Infections. The role of infections cannot be underestimated. And what sort of infection? Basically the congenital syphilis, and secondly the viral hepatitis. Okay, then we may have certain maternal causes. Okay, now coming to the placental causes. As I have told you, the third cause is that of placental. And what are the placental causes? Among the placental causes, we have chorioangioma and AV fistula. If we have AV fistula in the placenta, that can cause polyhydramnios. Okay, then the effects of the different drugs. Okay, and for example, antipsychotic drugs, if the mother is taking antipsychotic drugs, then that can cause the polyhydramnios. And fifth is that of the idiopathic cause. So these are certain important causes of the polyhydramnios.